Medicare, in a weird way, stipulates the business plan of the entire healthcare industry because doctors and hospitals get reimbursed for Medicare and Medicaid patients. Now, on the Medicaid side, many states actually have passed telehealth parity laws, which is really encouraging because they are actually reimbursing for some of this stuff, but it's state by state by state. So I would say that's actually a huge barrier to adoption because if I'm a doc or a hospital, I'm really going to use the equipment that I'm going to get reimbursed for, and I'm going to use or effectively deliver services that I'm going to get reimbursed for.
Let's take Google Helpouts as an example, because you all have a healthcare vertical. If I said today to a bunch of doctors, I'm going to pay you $100 for each one of these sessions. I shouldn't have said that number. I'm going to pay you $25 for each one of these sessions.
You don't have any physicians.
And you just actually ask them to, they still wouldn't know how to do it. There's actually a cultural and workflow change. So the payment is a minimum enabler, but our hypothesis is that unless you actually have either value-based payment in place or some of these direct primary care models that are emerging like Iora or Q-Liance up in the Pacific Northwest. We're watching them very closely because there's a different service model, and if you focus on the consumer experience, great things will happen, but doctors, just as you mentioned earlier, they don't change their behavior overnight.
I think there is definitely a generational cultural event that's about to occur. You think of when I first deployed the first EHR to a group of senior physicians, they wanted to burn the hospital to the ground. They hated it. And then, buzz ahead to the young, motivated White House physicians when we deployed to the White House. And, their first statement was, we're mobile, how we enter in this data on a mobile platform. We're gonna be up on a plane, we're gonna be up in front, how will we do that? And then the next question will be the generation that's coming through who's always online. They don't know a life not online, who will always be on, we'll just say Skype or GChat. I think seeing patients in that, for our colleagues, next generation back, I think that will just be commonplace for them. So some of our problem internally, just us, is we're the forward early adopters, and we're trying to drag the rest of the community up. Like, come on, we're all going to see patients on a mobile telemedicine platform. And the older physicians are like, it's not going to happen with me.
I think that obviously we talk about context, which is very important that a mobile device allows. So we used to talk about channels being a print magazine or TV or any other way to communicate. Now we talk about context, because with a mobile device, you have the ability to think about where is the location, what's the actual time, what's the intent of what that person might be doing, and we think about that in the actual device that they have. So there are all these new signals that a mobile device allows us to capture, and us meaning collectively, not just Google. And so it gives us a whole new way to think about how we would communicate. And from a medical perspective, think of what that does if you're able to know, again, where a patient might be at a certain period of time. You are able to get some type of biometric feedback as a signal, regardless of what that might be. You know the context that they're in, and so therefore you have a completely new vision and ability to see and understand what that person might need at any point in time. So we think that's very exciting, obviously from an advertising perspective, and then from a user perspective, it's a win-win in the sense of if you're using that ability to understand if you want something or looking for something, what you get as a result is much more tailored. It's the right thing at the right time at the right place.
Just for mobile devices in the healthcare industry, for the provider side, right? So just physicians, nurses, design matters. It has been horrible for years. Shame on all of us for putting these things forward. You know, again, there was a hole in aviation. You know, there's never one cause of a mishap. It's the pilot was drunk, the weather was bad, and then the maintenance was bad on the aircraft, right? All that comes together into a mishap. You know, there was a big mishap for why the whole nation wasn't moving to a digital platform, one part of that, and we talked a little about some of the other parts, one part of that was, God, they were just all ugly, and they were not intuitive. You know, it takes a 16-year-old, 20 minutes to get up and running on any video game, but it takes a board-certified neurosurgeon 2 weeks of, having to sit in a classroom to figure out how to enter data, right? So it just, and I know we're all starting to begin to understand design and heuristics and the human factors, that we used to put into a cockpit, but now put that on software. But please, I think without that, it's going to be a rough go to get product to market.